Welcome to the Chinese Medicine Podcast with your host, Marie Hopkinson, Chinese medicine practitioner.
Hi, I'm Marie Hopkinson and welcome back to the Chinese Medicine Podcast, and today I'm joined by Dr. Abbie, who's got a very special interest and has built an entire practice around various cosmetic procedures and cosmetic styles of acupuncture. So it's very interesting to learn about what you do.
Yeah.
So welcome.
Thank you for having me.
Awesome. Can you tell us a little bit about how you got into doing cosmetic acupuncture?
Initially, I was a naturopath, and I worked in a medical centre where we had a lot of allied health practitioners there, and I'm quite competitive in nature, which is a strange thing to do in health. And I was working with a Chinese medicine practitioner, and we were sharing some clients, and I watched her reduce a patient's stomach by an inch postpartum, and this is all this client ever cared about, and I was like, are you fucking kidding me? So that was my first kind of introduction to it, and then a few weeks later we were talking, and I felt like she was getting better results for my clients with quicker time. She's picking up diabetes before the GP, she's picking up cancer before there were even symptoms, and then she showed me, she did a facelift on a client, and I, at that point in my life, was so far deep in bush as, you know, all the conspiracy theories and Wi-Fi is going to kill you, and I was so left of centre, and I just was suddenly drawn back and been like, I don't have to sacrifice my vanity or what makes me feel good for my ethics and my health. And then I jumped ship and retrained in Chinese medicine. Wow. So that's how I found it and loved it, and I have just been solely focused on you don't have to sacrifice your ethics or your health concerns to feel pretty, which we all want to feel at some point.
Yeah, that's amazing. That's awesome.
Yeah.
And so I guess a lot of people watching this video might have a question, just a very basic question, like what's the difference with how does cosmetic acupuncture work to, say, let's say going to a beauty therapist or even having Botox or something like that?
Totally. So it's different in the fact that it's always constitutional. So Chinese medicine can't separate your elbow from your feelings, from your heart rate to anything else that's going on. And so cosmetic acupuncture is exactly the same ethos. So we're reading your facial diagnosis for what your organs are talking to, how your shen's presenting itself, what is your areas of concern or areas you want to polish. And so it's different from going to see a dermatologist or a beautician in the fact that we're not about necessarily your skin care, we're about the skin from within. So how's your internal health system expressing on your face? So it's not different potions and lotions. I'm not a beautician. I love to get a facial because that feels delicious. I'm a Chinese practitioner, really working on fine lines, building extra collagen in the area, working on elastin. For it being cosmetic acupuncture, we have to manipulate your hormones because estrogen is a precursor to developing collagen. So we need to make sure that all of that is juicy and doing what it should, and then we just manipulate and redirect chi and blood to where we want to polish.
Okay. Sounds really interesting. So it's not just like the external applications that you're doing that you might have when you go to a beauty therapist.
No, we do a little bit of like out to in and in to out. So there's definitely localized needling as well as your entire body is treated at the same time.
Yeah. And so I guess like maybe some patients come in and they have a concern about their skin, but then they might also in the consultation find that they have something else that Chinese medicine could treat, right?
Like for example, I've got a client at the moment which like humans' priorities cracks me up. So this woman has got multiple health concerns, which is irrelevant to why she's coming to see me. She's just like, I'm a bit red here and I don't like it. So she's got like clipples and blood vascular disorders and scarring and IBS and all of this, but just the redness. And then through treatment, we started reducing the redness under her eyes and the collagen, like she's lost about 10 years off her face. And through the process, we've managed to avoid surgery on her neck, surgery on her hand, and increased her bowel movements. But all she really wanted to come forward with the eyes, and all the rest of it was a bonus. And I just pissed myself laughing. As long as she feels good.
It's very common with Chinese medicine that people maybe come in for one thing, but then find in the course of the consultation that there's a lot of other things that Chinese medicine could help with that they might not have just been aware of it.
Call them side benefits.
Yeah, exactly. Yeah. But it's good to know that you can go somewhere where you specifically want to target your skin and specific procedures, which we're going to talk about what makes it different. I guess another question might be that our listeners or people watching might be asking is, well, could you just go to any acupuncturist or any Chinese medicine practitioner? Can they do what you do?
You could, but you wouldn't be getting the same results. Cosmetic acupuncture is another branch of Chinese medicine where you want someone who's specially trained in it. You're dealing with a lot more number of needles, you're dealing with a lot more vascularity of areas.
What does that mean for people that don't know?
Oh, sorry. So there's so much more blood vessels in the face. There's so much more prone to bruising. There's so much many more nerve endings that are in the area that you want to be using. And I'm an elitist. I'm really fucking fussy with the oil that touch me, let alone what I present to the world. And if you're fussy with a hairdresser, you should be fussy with your face. So ideally, if you're looking at someone who does cosmetic acupuncture, you want to know where they've trained, who they've trained with, do other people do it, and good questions to ask are, how do you treat bruising in clinic? How many sessions am I going to require? And not that there's a cookie cutter answer for those things, but someone who does a lot of cosmetic is going to be prepared to answer these questions for you. And of course, make sure that they're registered, because there's a few renegades out there at the moment, and I've been picking up the pieces of them mistakes.
Yeah. So if people aren't aware, because some people watching this are from different states and countries and things like that, and we're both from Australia, and we have the same regulation here, and what can happen, and this is very common in the US as well, that people can do needling but not be they don't need to be registered because they're technically not breaking the law, but that doesn't mean that they're necessarily trained to do the needling even in the first place. So,
and I also think they don't have the same consequences to error that we would have. So Australian Americans, we pay a lot of insurances, we have to keep so many hours of registration, so many hours of professional development every year, and if we were to break any of those rules or laws, we actually lose the right to practice. Someone who doesn't have these qualifications, if they make a mistake, can still continue to practice.
They often just start up in a different business name and no one can stop them from keeping on practicing. So the ways you can check is, in Australia it's AHPRA, A-H-P-R-A, I'll put the link below, you can check that out. And that means that your practitioner is firstly registered to do acupuncture. But what Abbie's saying is that some practitioners are then additional, so you might do your 4 years of training in acupuncture, but then you can't just learn, what you learn in an acupuncture school doesn't qualify you to do.
Isn't that extra zhuzh?
So you've done additional training and things like that.
Yeah.
Awesome. Okay, so there's something that you do in your practice called gua sha, or lots of practitioners do a thing called gua sha, or you might have seen channel rubbing or channel scrubbing or different names used for it, but you have a
tiger marking.
I've never heard of tiger marking.
Chinese hickeys.
Oh, I've never heard of that one.
Oh, that's what we call it.
We don't have that over in Perth. Maybe that's a Melbourne thing.
Yeah.
But you have a thing called glow sha. Right?
Yes.
So do you want to tell our listeners what glow sha is?
So our point of difference is, if you come get acupuncture for your face at Zhong Centre, our main aim is to get rid of you. So the more that
you don't want to see me.
No, not at all, not at all. Because realistically, what we're competing with is a patient market, which is why people love fillers and Botox, because you rock up, you get it done, you piss off. However, because we're not a drug, we need to build up the body's momentum, and the best way for any health system or anything Chinese medicine is your lifestyle that you take home. So we teach all of our clients gua sha, which is a form of jade scraping on the face. So I'm going to be really frank and honest, I think jade rolling is a proper shit.
Okay.
Alright, those rollers that you see that look beautiful on Instagram.
I'll insert a photo there so people know what a jade roller is.
They drive me fucking mad. They don't do anything. They feel lovely, okay? They're beautiful and luscious, but they don't make you look younger. They don't get rid of any fucking
I'm going to
wrinkles.
throw away I have a jade roller at my editing desk. And I hardly ever use it, but I just have it there to pretend that I use it. Yeah, so I'm going to probably use
this shit actually works. Another reason why I do cosmetic acupuncture is because I'm very, very pessimistic by nature. Don't know if you've noticed. And so I can visualize reducing. So the reason I love gua sha is because when you scrape your face, you're actually moving lymphatic, you're actually tightening muscles, you're able to get rid of your own TMJ, and people will notice your skin looking different within a fortnight. It's a face gym. So we get our clients to practice using this so that their maintenance treatments between cosmetic are longer. Again, if you're relaxing your scalp, then you're relaxing your face. It gets rid of all the lines, so it softens everything. If you can separate a line and it's gone, you can treat it to be eradicated. If you separate the line and it's still there, you can only ever soften it. It would take a few years of Botox in order to eradicate that, and even then, sometimes once they've set in, that's your lesson learned. But gua sha is fantastic because it moves lymph, it builds collagen, you can directly get it where it needs to go, you can treat your own sinus at home, and it's fantastic to do before putting on your makeup. So my clients use this every day or at least 5 times a week. We say gua sha on Netflix because we're now going to remember to do it. And you don't need as much makeup on anymore because the even tone in your skin has changed. Sometimes your rosacea is lighter.
You won't be needing to fill in the cracks.
No, because you will be glowing.
Yes.
But the beautiful thing that I love about it, and we specifically use jade because again, I'm Chinese medicine, I'm elitist. I like that jade as a stone is a lot softer, so you're less prone to actually marking on the face than if you Google gua sha, you'll see streaks up people's backs, pechier down the neck. And we still do that in clinic.
Yes.
However, you don't want that on your face if you have a wedding coming up.
Yeah, absolutely.
Yeah, so 60 seconds a day. No, 60 seconds a day for a fortnight, and people start noticing that something's a bit different about you. So I have an online course to teach people how to do it themselves.
Fantastic.
Yeah.
We'll put the link to that in the description below into this video, and then
you can read your own face with some facial diagnosis that we give away.
Yeah, fantastic. Sounds really good. Okay, so we've kind of talked a little bit about how cosmetic acupuncture is a bit different to other treatments. Is there anything else that makes it, if someone's decided should I get Botox and fillers, or should I have cosmetic acupuncture? What would you say to help them make that decision?
I'm obviously a little bit biased. Come to me. But realistically, in clinic we treat people that have Botox and fillers. We don't care. So the ethos that Zhong Centre goes by is if it makes you feel good, fuck it, we'll work around it. Like if that's all it takes for you to stop picking at yourself, go for it.
Okay.
I would suggest try a course of cosmetic acupuncture first. See if enough of the symptoms abate that you feel good about yourself that you won't need it, or you can push off getting it. A lot of my clients that do have Botox, the treatments elongate the lifespan of it, which is fantastic because Botox is a neurotoxin. It does have side effects. Your body can at some point start to reject it and it no longer works. That's also very common. And other side effects that people may not be aware of is long-term use, which is classified as 3 months or more. Sometimes you get more than 3 rounds. You can get bizarre coughs, rashes, and the worst side effect is dysphagia, where you cannot swallow anymore. I haven't seen much of that, but I've seen the area affected. So it's more about being consciously aware that those are some things that can interfere. So if you're thinking of Botox or thinking of getting fillers, my first advice is get it from a doctor, not a nurse, and make sure it's someone that you've seen what they've done. They don't pressure you into a sale. They don't get you in to check your skin and next thing you know, a needle's whipped out. We have a lot of sharks in that industry, and 2 years ago, Australia superseded America per capita of cosmetic options being done. So yes, it's a huge amount, and we are regulated, but there are still a lot of mistakes happening. 6 months ago, a woman went blind being done with Botox in the Sydney hospital by a registered nurse. Things can always go wrong. So I would say do your research, and then if you're going to try cosmetic acupuncture, give us 6 to 10 sessions, and we're about the same price. To get your whole block of your forehead done, you're looking at anywhere from 15 to 2,000. 10 sessions of acupuncture is about 1,500, and so you're treating your period pain at the same time, your sleep, your anxiety, and you're getting a fresh face. I would say it's more bang for buck. Health claimable as well. I don't know
rebates for people.
how fun rebatable. I don't know any Botox that's rebatable.
Wow.
So those would be how I give you a balanced decision as to what you're going to do. Obviously, bias.
So maybe for people that don't know, maybe if you're new to even acupuncture in general, acupuncture doesn't inject anything into the body, whereas
Not at all.
Botox is an injection of Botox into the body, so that's where the toxin comes in. Now, there's always risks with acupuncture as well. It's not risk-free because you're going to insert a needle somewhere. And what you said before is really important about the more needles you stick into an area, especially your face having a lot of blood vessels there. You want someone who's got that training, that has had experience, that's inserting a lot of needles into the face.
And they can do it with care, that doesn't implement a lot of pain. It's actually it's so strange. It's an extremely relaxing process because there are so many points in the head as far as Chinese medicine is concerned that is sedatory. So we do all the sedation points and you kind of get this weird buzz glow and it gets to a point where all my clients go, I can't talk anymore. And I'm like, excellent, this is working. All the endorphins are being released, so you get like a rush of zen, and all my yoga teachers say it's better than Shavasana.
Wow.
So, there's definitely a benefit to stimulating the body's own healing process.
I think in our modern world we can all use a bit of extra relaxation. Just that having that time out, I know is when a lot of I don't do cosmetic acupuncture, but in my practice, some patients tell me that the acupuncture time is the only time they can relax. Which is, it's sad in a way, but it's good that at least people can have a place somewhere to go to do that.
Lots of people hang out for that nap.
Yeah. And so how did you develop your cosmetic acupuncture technique? What was your story?
Well, I did my internship in China, and I did a lot of training there with the collegiate that I studied with, and I followed some plastic surgeons in Hong Kong. I trained in France and did some training for facial inflammation under Dr. Tan over there. I also did a lot of training in New Zealand and Japan, and so I also have a Chinese mentor here, so I'm constantly wrong. Anyone who has a mentor knows that you're always wrong. So I've worked really hard to make sure that the results that we get in clinic are long lasting. Like if you're going to be investing in your health and wellness, you want to make sure that you're getting feedback on it. So I've been developing it over about 5 years. So now I run trainings and seminars for Chinese medicine therapists, and I do train gua sha for beauticians. So I won't train anything other than Chinese medicine practitioners for acupuncture. I've had a lot of chiropractors and health coaches want to learn it, and I think it's a Chinese thing, the way we describe the Shen, the way we look at your organs, the way that we understand how the health system works. So I run trainings in Bali, New Zealand and around Australia. I'm currently trying to find some contacts in France to train over there. And then
we'll pop the links below for the training, so if there's other practitioners or a lot of students watch my channel.
We take final year, so it's a really integrative course teaching you freehand, because freehand is the most profound way to reduce bruising.
Right.
We teach you scalp holding points, face lifting points.
A lot of students just get scared of freehand because they're not taught how to do it properly.
Yeah, and the other thing is we need to teach people how to cut the time down. Like I could probably put 50 needles in the face in under 90 seconds. And you want to make sure that they're holding, they're stimulating.
Are you a Guinness Book of Record holder?
I won't be far off, I'm very impatient. No, so you also want to be able to implement quickly so that the client can get to their nap faster, and it can be a little bit of costing if you've never been through the process, and you want to make sure you're confident, you're quick, because the quicker you can get to the chi circulating, the quicker that face is going to buzz and glow. So very, very focused on that. And then with the gua sha training, we train health practitioners and beauticians and dermatologists so that they can teach their clients how to do it, and they can implement it into their beauty regimes at the moment, because Jade Rolling's driving me fucking insane. I have to take it down. So like if you can
throw away your Jade Roller,
get rid of it. It's great for sunburn. It's great for sunburn, but I just get so upset because do you feel like your face is tight? Like it doesn't. Anyway.
So if you want to learn how to do the special technique that you've developed, the glow sha, the glow sha, then you can sign up below and you'll be able to find the links to the course that you run, and the other things that Dr. Abbie does in her clinic. You can investigate that through the link as well through your website, and you're on Instagram as well, aren't you?
I do a lot of swearing on Instagram. I feel like I have to put a parental warning on there. I think most people follow me for my
18 plus.
Just be aware there's a lot of profanity, and it's not glamorous, it's not pretty.
Do you want people to follow your Instagram?
Look, if you're prepared for a bit of chewed, go for it.
If real you.
I get it. I think most people follow me for my angry rants. I get really pissed off at the beauty system and
Jade Rollers.
Jade Rollers, and you know, females not being allowed to age. It's a real vendetta of mine. So cosmetic acupuncture makes you look younger, feel younger, but the main thing is you have your vitality back. And it's not about not being allowed to age. Like I still have lines and wrinkles. It's about glowing whatever age you're at. And so Instagram is my way of venting about how the media is just not letting us be flawed.
Well, I'm sure there's a lot of people watching this that will be interested to hear your angry rants and to get to know more about you. So I'll put the link to that one as well with a little
disclaimer. There is profanity.
I think people like profanity. That's what I find. Awesome. Well, it's been really great to have you on the podcast and to talk about this. And it's something that is really, it's such an interesting area. And if you don't know, people just make assumptions about things they don't know. So hopefully you've learned something. And if you've got a question or you've maybe had an experience yourself with something that we're talking about, you can pop a comment below. Because we'd love to hear those comments and respond to those comments. And I'll do the best that I can to respond to your comment about what I know about it. And I think one thing that you have to remember about Chinese medicine with the amount of years that it takes to practice. And I think it's great that you're saying you're only going to train Chinese medicine practitioners in the cosmetic acupuncture, because it's not like just sticking the needles in and learning those techniques. And so the 4 years that you do it, you need to be a Chinese medicine practitioner, a trained acupuncturist first. That gives the practitioner the foundation to
understand what to do.
Yeah, the
For
constitutional
example,
diagnosis.
We can't do points when there's a full moon. There's certain points you avoid when you're menstruating, and from Chinese medicine, depends what kind of menstruation cycle you have. There's different points that we use when someone's ovulating, different points you use on a transgender, different points you use on men.
Menstruating? What if they're menstruating?
If they're menstruating, again, you're treating the spleen differently. Again, and like we have a lot of gay clientele. I'm secretly a gay man in a straight woman's body. So again, with what's happening in their lifestyle or in their shen at that moment, we're not just doing cookie cutter treatment. So, and this is where the Chinese medicine gives us that cutting edge to really make
it's only through Chinese medicine that you can get that individualised approach. Otherwise, it would just be stock standard. Everyone's getting the same thing, line up, and
totally.
So that's awesome to know that you're doing that, and you really care about this part of the industry and taking the time to make the courses for people. That shows you care. So
and making sure they can go away and do it with total sass.
So hopefully you can go and visit Dr. Abbie's clinic or Instagram, whichever order you feel the most inclined to do so. And thanks so much for being on the podcast.
My pleasure. Thank you for having me, everyone.